Hi everyone, how are you? Our today's topics is carcinoma of the breast, which is one of the most common carcinoma in case of female worldwide. So here we can say cancer is the most frequent cancer among the women. So the breast cancer is the prime cancer, or it is the most frequent cancer in case of female. In Western Europe, approximately 1 in 9 women will develop breast cancer. So it is almost 11% of the population they develop breast cancer. So it is almost 11% of the women. So 1 in 9, it is more occurrence. Then here we can see, but in the poor country, they 1 in 28 women, which is very less related to the well-developed countries. So in poor countries, 1 in 28 women will develop breast cancer, and in case of Western countries and developed countries, 1 in 9 women develop breast cancer. And here, every 2 women diagnosed with breast cancer, one dies of the cancer. So it is very fatal condition. That means if we diagnose 10 patients of breast cancer, among them 50%, that means 5 patients will die in the breast cancer. So it is very fatal. So here we can see the risk factor of the breast cancer. There are risk factor divided into two groups. One is the modifiable risk factor, and another one is the non-modifiable breast risk factor. So first of all, let's see the modifiable. Here we can see the estrogenic exposure of the breast are said to be risk factor of the breast cancer. For this reason, breast cancer is more common is female, because the breast, it has the estrogenic receptor, and the estrogen, it is more in female than that of the male. In male, there is some sort, that means very small amount of estrogen present. So we have to remember the male also, they have some of the estrogen, very few amount, and in case of female, as the estrogen is more, so in that case breast cancer is more. So we have the modifiable risk factors. First of all, obesity, BMI more than 30, variety, then breastfeeding, age at first childhood, use of HRT, tobacco use, alcohol consumption, and radiation exposure. So these are the modifiable risk factor of the breast cancer. And here some non-modifiable risk of the breast factor. First of all, age, sex, ethnicity, family history of the breast cancer, genetic predisposition, early menarche and late menopause, and high risk breast lesion. So they are the non-modifiable risk factor in case of the breast cancer. Again, age, sex, ethnicity, family history of breast cancer, genetic predisposition, early menarche and late menopause, high risk breast lesion. Now, pathology of the breast cancer. First of all, here you can see the breast carcinoma arises from the male duct in case of 90% case, and from the lobule 10% case. And this male duct, it's known as the lobular carcinoma, and in case of ductal, it's known as the ductal carcinoma, and in case of lobule, it is lobular carcinoma. So the breast cancer is divided into two group: ductal carcinoma and lobular carcinoma. And among them, ductal carcinoma is more common, it is 90%, and lobular carcinoma, it is only 10%. Disease may remain confined to the epithelium of the duct or the lobule, and lobules of the basement membrane, and it is called in situ disease or carcinoma in situ. So this is very important, that when it no breast basement membrane, it is called carcinoma in situ or in situ disease. That means the breast, it affected by the cancer carcinoma, but this carcinoma don't invade the basement membrane, doesn't invade the basement membrane. So though it is carcinoma, it is in situ carcinoma. But in case when it breaks or break down the basement membrane, it is known as the invasive or infiltrative carcinoma. Invasive or infiltrative ductal carcinoma, invasive or infiltrative lobular carcinoma. So it is in short about the pathology of breast carcinoma, that about 90% arises from the duct and it is known as ductal carcinoma, and about 10% it arises from the lobule and it is known as the lobular carcinoma. And when it not breach the basement membrane, it is called in situ disease, and when it breach or break down the basement membrane, it known as the invasive or infiltrative carcinoma. And the carcinoma or tumor may be differentiated into the well differentiated, moderately differentiated, or poorly differentiated. Well differentiated, that means the cells are recognized to us. Moderately differentiated, that means some of the cell are recognized to us and some of the cell are not similar to the breast tissue. And poorly differentiated, that means most of the cell or most of the tissue, they are not similar to the breast tissue. The tumor cell may overexpresses estrogen receptor, and when the tumor cell it contains more of the estrogen receptor, this condition it is known as the estrogen receptor positive. That means the estrogen positive or ER positive. And when progesterone receptor more, then it is called PR positive. When human epidermal growth factor receptor is more in breast tissue, then it is known as the HR2 or new positive. And when androgen receptor present in breast tissue, it is null, then AR positive. And the degree of mitosis can be detected by the Ki67 mitotic index. So this red mark area is very very important, because any surgery of the breast, purely we check the different type of receptors such as ER, VR, HER2, AR or Ki67. So these portion are very very important regarding the treatment of the breast cancer. Now the spread of the cancer, the carcinoma of the breast, it can be spread in different pathway. First of all, here we can see the local spread, that means from the one breast to another breast, then, or in the surroundings area. Then here we can see the lymphatic metastasis may be developed, and here we can see the hematogenous spread. So spread of the cancer may occur in the one of the three way: local spread, lymphatic metastasis, or hematogenous metastasis. So it is in short about the breast cancer epidemiology and pathology and spread of the breast carcinoma in case of female.